How do you know the treatment that you're doing for your lower back pain, for your neck pain, for your shoulder problem? How do you know that that treatment is the right treatment for you? Well, we can assume that if you're addressing the cause of the problem, you're going to get better and you're going to heal and you're going to stay better. So let's take a look at this. And you can run any treatment through this. Let's say you have 5 out of 10 pain every time you roll out of bed in the morning. Okay? So you have 5 out of 10. Okay, and it's been that way for some time, and you decide that you want to start putting a hot pack, which we know really does nothing for you long term, but you want to sit on your recliner at night with a hot pack to try and have less pain in the morning when you wake up. So you do that, okay? You wake up 5 out of 10. As you go throughout the day, the pain decreases. Before you go to bed at night, you put the hot pack on. Next morning you wake up, you roll out of bed, it's a 5 out of 10 again. You can do that forever, okay? And we call that the roller coaster effect. And we've seen many people that have done that for 40 or 50 years, doing that with hot packs, with Flexol or some other type of blue smelly cream that they're rubbing on their body. Gives them temporary relief, but no long-term lasting relief because they're not addressing the cause of the problem. We call that pretend help. What is true help? True help is you address the cause. And this is what it looks like. So we have the same 5 out of 10 pain every time you roll out of bed in the morning, okay? So it takes 30 minutes or an hour before you're up and moving, before you can move without pain. So you have 5 out of 10 pain when you wake up in the morning. So it looks like this. 5 out of 10, you get up, you move around, you feel much better. Let's say you see a therapist, and that therapist says, well, you need some traction. You have arthritis in your back, and if we open up that space, I think we can move you in the right direction. So let's say you get a traction treatment, and the next morning you get out of bed, you only have a 3 out of 10. Okay? So have you moved in the right direction? Absolutely. Are we addressing the cause of the problem? Yes. And what will happen is within a few weeks, as you continue to wake up and as you continue to go back to that original problem activity, you should get to the point where you no longer have the pain when you get out of bed in the morning, or it's significantly less. Maybe it's a 1 or 2 instead of a 5. Traditionally in our clinic, that can happen in 4 to 6 weeks. Address the cause of the problem with a therapist that knows what they're doing, and you're going to get better and you're going to stay better.